Right, so thanks for joining us for this webinar where we'll be looking at bone health. So both at what we can do at a younger age to build up peak bone mass and strength, and also how we can preserve it in middle and older age. So many clients take bone health for granted until they're presented with a diagnosis of osteoporosis. And because it's mostly asymptomatic in the beginning phase, this is often only after they've had a fracture. So as with all things, prevention is much better than cure. But luckily, even in those who have already been diagnosed with osteoporosis or osteopenia, there's a lot we can do to support the condition from a nutritional standpoint. So in this webinar, we'll look at bone health and the consequences of low bone mineral density and strength, the most important nutrients, other lifestyle choices for bone health. We'll introduce our new supplement targeted at bone health and look at what makes it really good in our eyes. And we'll look at some research studies. So bones play many roles in the body. So they provide structure, they protect organs such as our rib cage, protecting our lungs and heart. They provide anchor for muscles, and they store minerals. So they act as a bank of calcium and magnesium, with the body able to make withdrawals as and when needed to maintain the calcium and magnesium levels in the blood at a very constant level. And these withdrawals might need to differ in terms of different metabolism, stress, and nutritional intake. So really we need to keep topping up the calcium and magnesium stored in our bones so that we don't deplete them when the body needs to make its withdrawals. So bone remodeling occurs throughout life, and it's really a balance between the action of osteoblasts, which are the cells which build bone, and osteoclasts, cells which break bone down. So at about the age of 30, we reach peak bone mass. And before that age, especially in adolescence, which is the time of the most rapid increase in bone mass, more new bone is being laid down that is being resorbed. But after that, the tables turn, and on average, we lose about 1% of bone mass per year. And in the menopausal and postmenopausal years, it can go up to 2% per year. So osteoporosis, often diagnosed with a bone mineral density scan, is decreased bone mineral density compared to women of the same age. And it's the result of an imbalance between bone deposition and resorption. So increased resorption with not enough deposition. And osteopenia is basically a lesser degree of this. So osteopenia doesn't always lead to osteoporosis, but it can. And if someone is diagnosed with osteopenia, they should really target bone health to prevent it progressing. So bone density scans were based on postmenopausal white women, and it's really most accurate in that age and demographic group in predicting fracture risk. And it's been said that in some other groups, such as younger women, it may not be as predictive of fracture risk. So if a younger woman has decreased bone mineral density, they do somehow have increased bone strength compared to an older woman with the same bone mineral density. And I won't go into it, but there are different scores that I looked at if a younger woman has a bone scan, such as the Z score versus the T score. All right, so osteoporosis literally means porous bone. It's the most common bone disease in humans, and it renders bones fragile and more likely to break. It develops slowly over many years, and it's usually asymptomatic and often only diagnosed when a minor fall or a sudden impact causes a bone fracture. And the fractures are often seen in hips, wrists, and vertebrae. And that hunched over appearance can be caused by vertebral fractures, causing that humped appearance. Not always. All right, so globally, every 3 seconds, an osteoporotic fracture occurs. And this amounts to 8.9 million fractures annually worldwide. The lifetime risk for a wrist, hip, or vertebral fracture has been estimated to be in the order of 30 to 40% in developed countries, which is similar to that of coronary heart disease. So really a very common problem. And the problem with osteoporotic fractures is it often leads to a slow, painful healing process where the person, especially if it's a hip fracture, can be bedridden and then get other complications like pneumonia, which can sometimes be fatal. And there's also a lot of loss of independence, which goes along with hip and wrist fractures. So there's no routine screening for osteoporosis in the UK, and there's no simple treatment. Medications often aren't completely effective. They are expensive if one has to pay for them, and they come with significant side effects often. So prevention is definitely better than the consequences. So there are quite a lot of different drugs for osteoporosis on the market, and they work by either inhibiting bone resorption or stimulating bone formation. Most of them inhibit bone resorption. So some women, for example, receive hormone replacement therapy, bisphosphonates, and other drugs for osteoporosis. So losing bone mineral density with age is normal, but some do lose it faster than others. So we'll have a look at some of the risk factors. So a diet low in bone supporting nutrients, for example, calcium, magnesium, boron, vitamins D and K, phosphorus, and high in soft drinks, caffeine, and salt. Especially during and after the menopause, it's the phase of rapid bone loss. Men can also suffer from osteoporosis, although it's not as common as in women. So men with low testosterone and other risk factors. The long-term use of high-dose oral corticosteroids like prednisone. So topical corticosteroids like nasal sprays, asthma inhalers, those should be fine. So it's really the corticosteroid tablets taken over long term. And then other medical conditions, such as diabetes, which influences the mineralization of bone, inflammatory conditions, for example, for rheumatoid arthritis, hormonal issues, so early menopause, hyperthyroidism, and malabsorption problems. Those with a family history of osteoporosis are more at risk, particularly if a parent has had a hip fracture. Those with a decreased body mass index, heavy drinkers and smokers, and Caucasians are the race most at risk. So in females, estrogen is really essential for healthy bones, and this is why after menopause, bone density decreases rapidly. So if women have had decreased exposure to estrogen during their lifetimes, they are at more risk. So for example, women who've had an early menopause, so before the age of 45, and those who've had absent periods for more than 6 months can have had less estrogen exposure. So for example, those who over-exercise or have eating disorders or too much dieting, resulting in suppression of ovulation. So what can we do for our bones? So we'll look at important nutrients in a moment and go into more detail. I think I've honed in on the calcium, magnesium, vitamins D and K here because those are the main ingredients in supplements. Of course, phosphorus is also important, which we get in our food, and boron as well. Then exercise. So the most important exercise for building bone strength is actually a combination of weight-bearing exercise and resistance exercise. But to note that exercise only improves bone mineral density really effectively in the context of sufficient bone building nutrients being present. So examples of weight-bearing exercise doesn't have to be hectic aerobic jumping. It can be as simple as walking, hiking, dancing, playing tennis, climbing stairs. And then examples of resistance exercises, lifting weights, using rubber bands, using resistance machines at gym. So although exercise like swimming and cycling do have benefits, they're not the best at building bone strength because the body isn't bearing weight during those exercises. All right, so looking at the nutrients. So calcium, 99% of our body's calcium is stored in our skeleton. But apart from its role in bone structure and growth and dental health, it also has many other roles in the body, such as nerve impulse transmission, muscular contraction, blood clotting, and hormone secretion. So calcium balance is regulated by absorption in the intestine. So if blood calcium drops, more will be absorbed from the intestine. Reabsorption in the kidney. So if the body needs to hang on to its calcium, less will be excreted in the urine, and then exchange from the bone. So the body will draw from reserves in the bone when it needs to boost the blood levels. So how much do we need a day? Well, it varies a lot depending on what source you're looking at, and it varies a lot around the world. So in the EU, we currently recommended to get in 800 milligrams per day. But for example, in the USA, they're now recommending 1,300 milligrams per day. And the World Health Organization recommends 500 milligrams per day. So a big range, really. Needs are higher in adolescents and the elderly. Because in adolescents, one really wants to build up your peak bone mass. And in the elderly, they don't have estrogen. They are losing bone mass more rapidly. So the food sources, I'm sure you know, dairy, bone and fish, green leafy vegetables. So just to note that those would need to, the green leafy vegetables that are higher in oxalic acid, such as spinach, should be steamed first, just to get rid of the oxalic acid to make the calcium more bioavailable. So for example, cooked spinach, the calcium is much more bioavailable. I think it's 2 to 10 times more than in raw spinach. So long-term deficiency in calcium leads to osteoporosis, muscle pains, twitching and cramps, heart rhythm disorders, and insomnia. But important to note that it needs to be combined with other nutrients for bone health. So just taking a calcium supplement alone won't improve bone health nearly as much as taking a combination supplement. So you might have heard of the increased risk of heart attacks with calcium supplements some time back. So, a randomized study was done of 1,400 postmenopausal women in New Zealand, and half of the women took 1,000 milligrams of calcium per day, so quite a large amount. And 21 of these women had heart attacks, compared with only 10 who received placebo, so about a doubling in the effect. And then a 2010 analysis of 15 randomized controlled trials also linked calcium supplementation with the increased risk of heart attack. So what one really wants to do is, if you take calcium in supplement form, to take it together with other nutrients, for, especially vitamin K2 in the MK7 form, because this will direct the calcium to the bones, so to the right place to get absorbed, and instead of it being deposited in soft tissue, such as in the arteries of the heart, leading to atherosclerosis, leading to heart attack. Other soft tissues that it could get deposited in is in the kidneys, causing kidney stones, and in the joints, causing arthritis. All right, so magnesium is the second most abundant mineral. 55% of our magnesium is stored in our bones, where it contributes to the density and strength of the skeleton. and the rest is stored in muscles and soft tissues and other intracellular components. So magnesium has quite a few effects on bones. So firstly, it provides structure and strength to bones. And then it also affects the regulators of calcium metabolism. So it affects parathyroid hormone, PTH, and vitamin D. Now, many diets are low in magnesium. So food sources are whole grains, green leafy veg, nuts, avocados, cocoa. So components of a healthy whole food diet. But many people obviously aren't eating that kind of diet, and it's one of the minerals that is most often a deficiency of in the standard Western diet. So low blood plasma magnesium concentrations lead to activation of bone resorption by osteoclasts and decreased osteoblast bone formation. Low levels of magnesium also impair the secretion of parathyroid hormone, and they render target organs refractory to it, so insensitive. This in turn leads to low concentrations of 25-hydroxy vitamin D3, which leads to low absorption of calcium from the gut and low reabsorption in the kidneys. Also, the enzyme which is responsible for the production of the most active form of vitamin D, calcitriol, requires magnesium as its cofactor. So basically, low magnesium can lead to low calcium and low active vitamin D. Low magnesium also promotes inflammation because in magnesium deficiency, substance P and the pro-inflammatory cytokines increase. And the last role of magnesium, it also plays an important role in carbohydrate metabolism. So magnesium deficiency provokes and worsens insulin resistance. This causes a higher blood glucose concentration, and this adversely affects mineralization in osteoblast cells. So basically less calcium is deposited into bones. And this is why diabetes is a risk factor for osteoporosis. Vitamin D plays a direct role in osteoblast function. So osteoblasts have vitamin D receptors on them, and vitamin D also affects gene expression in osteoblasts. And a vitamin D deficiency results in poor growth, bone pain, and deformities. So in children, it leads to rickets, and in adults, to a bone disease called osteomalacia. It also leads to osteoporosis, gum disease, and other side effects, such as constipation, muscle weakness, immune system dysfunction. So currently our UK recommended supplement intake is 10 micrograms per day over the winter months, but many would say this isn't enough. And also, although vitamin D is found in some animal foods in quite low quantities, so really our main source of vitamin D is sun exposure, which during the months of May to September might be sufficient, but often isn't, and especially during winter, almost everyone is recommended to take a supplement, and often people take much higher dosages than the recommended amount. All right, so vitamin K, we'll just go into the types of vitamin K a little bit. So vitamin K1 is found mostly in leafy green vegetables. Vitamin K2 is found in animal foods and fermented foods. And the two of the most commonly known forms of vitamin K2 are MK4, which is found in animal foods, and MK7, which is found in fermented foods, for example, natto, which is fermented soya. That's the richest source of it. So not many of us are getting in too much of it in our diets. So vitamin K1 can be converted to K2 in the body, but it's a bit of an inefficient process. So for those who are not taking in enough K1, so aren't eating leafy green veg, they might not have enough K2 to convert. And those who are targeting a condition such as bone or dental health, to be assured that you're going to have enough MK7, K2, you might want to take a supplement, as well as especially if you're taking calcium supplement, just to make sure that it gets deposited in bones and not into soft tissues. So vitamin K1, as it travels around our body, travels especially to the liver, where it is used to make the proteins involved in blood clotting. Whereas K2, MK7 reaches bone more readily. In bone, its role is to encourage calcium absorption into bone, but it's also used to make the hormone osteocalcin, which improves blood glucose control by increasing insulin sensitization, and also has a role in hormonal health. All right, so in hormonal health, it helps optimize sex hormones. For example, it increases testosterone and fertility in males, and it helps to bring high levels of androgens down in women with polycystic ovary syndrome. So MK7, K2 can also help in blood clotting because some of it does reach the liver, and it has a longer half-life than K1 in the liver. Also, just to note that although the human gut bacteria are capable of synthesizing MK7, K2, the bioavailability of it is poor, so we can't absorb much of it that is made. All right, and then just a word about MK4, K2. So that's found in animal products such as meat, dairy, and eggs. And it can be converted from other forms of vitamin K. It's most abundant in the tissues of the body rather than in the liver or the bones. And it contributes to hormonal health and also altered gene expression and the prevention of DNA damage. So if you just need to know one fact or give this to your clients, is basically that MK7, the MK7 form of K2 is the most important form of vitamin K for bone health. All right, boron. So boron's role in bone health is that it increases calcium, magnesium, and vitamin D3 absorption, and it reduces calcium and magnesium excretion. It also increases the half-life and bioavailability of vitamin D3 and the sex hormones. It also regulates the gene expression of mineralized tissue-associated proteins and extracellular matrix proteins, such as collagen and osteocalcin, as well as some others. And it helps to boost osteoblast cell viability, proliferation, and the mineralization of bone cells. Boron also helps to reduce inflammation, so it reduces the levels of inflammatory biomarkers, such as CRP and tumor necrosis factor alpha. It raises levels of antioxidant enzymes, and it protects against oxidative damage from heavy metals and other toxins. So evidence actually supports the use of boron as a safe and effective treatment for bone health and some forms of arthritis, with a 3 milligram daily dose established as the amount recommended for any individual who's consuming a diet lacking in fruit and vegetables, or who's at risk for or has osteopenia, osteoporosis, or osteoarthritis. So Western diet trends. So if one looks at the National Diet and Nutrition Survey, this shows that 20% of individuals are vitamin D deficient, but that's at the very lower threshold of 25 nanomoles per liter. So a lot have suboptimal vitamin D levels. So in adolescence, adolescents tend to have low magnesium levels, although a lot of adults also have suboptimal levels. Calcium intake is variable, so some people on standard Western diets are getting really sufficient and more than sufficient calcium, whereas some wouldn't be. So those who aren't consuming dairy especially. And then our diets are low in vitamin K2. So just remember that if magnesium, D3, and K2 intake is not sufficient, the body can't fully utilize dietary source calcium for bone strength. All right, so just quickly, so bone health is really a synergy of various ingredients. So just to run through it quickly, so a 2-to-1 calcium-magnesium ratio is considered optimal for bone health. They do compete for absorption in the gut, so that's why it's important to have a balanced ratio, which aids in calcium absorption and also magnesium absorption, which in turn leads to the conversion of vitamin D to its active form. Magnesium and vitamin D, so vitamin D enhances magnesium absorption, but magnesium is essential for the absorption and metabolism of vitamin D to its active form. Then vitamin D increases calcium absorption, and K2 ensures calcium is deposited into the bones and teeth, so that's another synergy. And then, as we said, boron increases calcium, magnesium, and vitamin D absorption, reduces calcium magnesium excretion, and increases the half-life and bioavailability of vitamin D. So those are all things we looked at when we put together our new supplement, which is the calcium and magnesium marine mineral complex. So in this we've included calcium from marine algae. This calcium from marine algae comes along with calcium, magnesium, and trace minerals. Then, in addition to the magnesium from the algae, we've also got some magnesium from seawater added. We have vitamin D3 from lichens, so vegan D3. We also have all trans MK7, K2, boron, and also, as I said, the trace minerals. And we really wanted to include as few excipients as possible. So there's no silicon dioxide or magnesium stearate. We've just used bamboo silica as our excipient in these capsules. So it's for the full dose, it's three capsules a day. And I actually forgot to include the nutritional panel. So basically, it will supply at 3 tablets a day. It's a little bit more than 100%, than 50% of the RDA. It actually varies depending on which country you look at. And also vitamin D3, K2, and 3 milligrams of boron. All right, so we've used this Ackerman seaweed multi-mineral complex. So it's the lithoamnion species of red seaweed, which grows in Iceland. And it actually looks more like coral than what we would typically associate with algae or seaweed. So as this algae is growing, it absorbs calcium, magnesium, and 72 other trace minerals into its cytoskeleton, which becomes really strong and dense in a honeycomb structure. Then as the algae dies, it breaks down, settles on the seabed, and the calcified skeletal remains are harvested using a certified organic and environmentally sensitive practice. The algae is then dried and then made into a powder. So it's an entirely chemical-free process and a certified organic process to produce it. The process is closely monitored by third parties and also strong relationships with the local government in Iceland. So as I said, this algae has a highly porous honeycomb structure, resulting in a substantially greater surface area per particle compared to calcium carbonate from other sources. So like calcium carbonate from rocks or shells is really dense. So it's thus easier to digest than traditional rock derived calcium carbonate. This is good news for absorption, but it also should give less side effects such as constipation, bloating, and nausea that some people get from calcium supplements. And this Aquaman supplement was awarded the Nutrient Ingredient of the Year for Healthy Aging in 2016. So both for contributing to osteoporosis prevention and support, and also assisting with osteoarthritis symptoms, which we'll hear more about later. All right, so some of the magnesium in the supplement is derived from the algae, and then we topped it up with some magnesium derived from seawater. And we topped it up to be at least, so basically the 2-to-1 calcium ratio is what we wanted to aim for, but we know that most people have are more deficient in magnesium than calcium. So if you look at the percentage of RDA, the magnesium is a little bit more than the calcium. And we boosted it with magnesium from Irish seawater. So this magnesium has an extremely high 35% elemental magnesium component, and it's highly soluble, so it's a highly bioavailable form. So if you look at, for example, magnesium oxide, which is often used in supplements, this is really insoluble and only has a bioavailability of about 4%. And even if a supplement doesn't mention that it includes magnesium oxide, there's often hidden magnesium oxide present. So in a 2018 study, Aquaman magnesium was demonstrated to be as soluble as magnesium chloride, which is a really soluble form of magnesium, and hence available for absorption. It also doesn't give the side effects that we see commonly with magnesium oxide of diarrhea. Then vitamin D3, as I said, we use vegan vitamin D3 from lichen. And this is in the D3 form, which is more bioavailable than the D2 form. For our vitamin K, we use soy-free all-trans MK7, vitamin K2. And the all-trans form is the nature identical form, so better than the cis form. So as with all of our supplements, we rather split our dose into smaller doses throughout the day for better absorption. So like I said, the full dose is 3 capsules daily, or 1 3 times daily. And the supplement is also free from all common allergens. And like I said, the K2 is soy-free. All right, so who might benefit from the supplement? Well, we're targeting it at the support or prevention of osteoporosis and osteopenia, but also those with dental health issues, those in menopause who really want to look after their bone health, and they might also find some relief from menopausal symptoms, because magnesium and boron can help with those symptoms. Those with muscle conditions, for example, muscle cramping or fibromyalgia, sleep disorders such as restless leg syndrome or insomnia, and then those that want to supplement their diet, who feel they might not be getting in enough calcium and other bone building nutrients. So, for example, those following a plant-based diet or avoiding dairy. All right, so there have been really loads of studies done on Aquaman, and Aquaman is only one of the ingredients in the supplement. So the Aquaman is what's providing the calcium, some of the magnesium, and the trace minerals. But just remember, the supplement is boosted by additional magnesium, vitamin D3, K2, and boron. So the studies that I'll present are mostly the Aquaman seaweed product. And really, the studies are not only on bone, but also on joint health, gastrointestinal conditions. So it's really seems like it holds promise for a variety of different aspects of health. All right, so the first study compared Aquaman to calcium carbonate. So the standard calcium carbonate that's inorganic, so from rocks or shells that you find in most calcium supplements. In an animal model of menopause to assess Aquaman's efficacy at preventing the onset of bone loss. So animals were randomly assigned to either a control group or to a simulated menopause group. So they were either given calcium carbonate, Aquaman, or they were given Aquaman in a delayed fashion. So where treatment was started 8 weeks after the onset of menopause. So at the end of the 20-week study, the bone architecture was measured using micro-CT, and the bone composition was assessed using infrared spectrometry, and mechanical properties were also assessed, the bone strength. So the results were that Aquaman resulted in less deterioration of trabecular bone structure, mineral composition, and biomechanical properties. So in an animal model of menopause, Aquaman was superior to calcium carbonate, inorganic calcium carbonate, at slowing down the onset of bone loss. All right, and then in postmenopausal women, in the study, it was a 2-year randomized double-blind controlled trial, and looked at whether Aquaman taken alone and in combination with short-chain fructooligosaccharides, so basically prebiotics, had a beneficial effect on bone mineral density and bone turnover markers in postmenopausal women. So 300 non-osteoporotic postmenopausal women were assigned to daily supplements of Aquaman or Aquaman plus fructooligosaccharides or placebo. So bone mineral density was looked at, as well as bone turnover markers. So although the change in bone mineral density did not differ between the groups, the greater decline in bone turnover markers in Aquaman and Aquaman plus prebiotics compared to placebo suggested a more favorable bone health profile after supplementation. And then supplementation with Aquaman plus the prebiotics slowed the rate of total body and spinal bone loss in postmenopausal women with osteopenia. So it's quite interesting. In this study, they didn't actually see a change in bone mineral density, but they did see that there were less bone turnover markers, so basically blood markers of bone turnover or bone being resorbed. And on looking into this, basically bone strength improves more than bone density with treatment. So in treatment given for osteoporosis, often doctors will judge the efficacy of treatment by looking at both the changes in bone mineral density and bone turnover markers. And of course, whether women get more fractures on treatment. So treatment is seen as a success even if bone mineral density doesn't change, but bone turnover markers drop. And that was the same as what was seen in the study. All right, so this was a study to determine whether Aquaman would prevent bone mineral loss on a high-fat Western diet. This was an animal study, as a high-fat Western diet is a risk factor for osteoporosis. So there were 4 groups maintained on these diets for 15 months. So low-fat standard rat food plus Aquaman, a high-fat Western diet, and a high-fat Western diet plus Aquaman. So the results were the female mice on the high-fat Western diet had reduced bone mineralization and reduced bone strength relative to the female diet on the low-fat rat food diet. But the bone defects in the female mice on the high-fat diet were overcome in the group with added Aquaman. And in fact, the female mice receiving the Aquaman with the high-fat diet had better bone structure and function than the female mice on the low-fat diet. All right, this was a study comparing Aquaman to calcium carbonate and magnesium oxide in menopause. So basically the standard supplements that one might buy with inorganic calcium carbonate and magnesium oxide, which is the cheaper form of magnesium, which is really not very bioavailable. So there were 4 groups: a control group, a menopause group, menopause plus inorganic calcium and magnesium oxide, and menopause plus Aquaman. So in summary, Aquaman resulted in increased femoral bone mineral density and strength in the menopause group. And the comment was that the results were possibly due to the characteristics of the organic calcium and the magnesium itself, but also due to the trace minerals in Aquaman. All right, so 2 lab studies were done looking at Aquaman alone and together with vitamin D on osteoblasts. So in the first study, the aim was to evaluate the effects of Aquaman on osteoblastic behavior in a pre-osteoblastic cell line. And Aquaman promoted increased mineralization in osteoblasts in cell culture with a 3-fold increase in mineralization. In the second study, vitamin D was added to Aquaman in the cell culture, and the results were increased mineralization and ALP more than Aquaman alone. ALP is a marker of osteoblast proliferation and bone formation. So these studies highlight, well, first of all, that Aquaman does promote mineralization, but also the important relationship between Aquaman and vitamin D. And it reinforces the recommendation that Aquaman is consumed along with enough vitamin D. So if one can't get it from sunlight, then the importance of vitamin D supplementation. So this study was a double-blind crossover study looking at Aquaman versus inorganic calcium in premenopausal women. So calcium metabolism markers were compared in these women. So blood and urine samples were taken for calcium levels and parathyroid hormone levels. So if one is giving Aquaman and calcium carbonate to women, it's difficult to measure increased absorption because blood calcium levels are maintained at a constant. And looking at bones, one can't see the immediate impact of increased calcium absorption on bones. So one has to look at surrogate markers such as increased urinary calcium excretion. So if you're excreting more calcium in your urine, that means that more calcium probably got into your bloodstream first, so better absorption. And then with additional corroborative evidence from a suppressed parathyroid hormone. Now, if your blood calcium was falling, your body would then secrete more parathyroid hormone to draw more calcium from the bones. So parathyroid hormone levels suppress generally when subjects are supplemented with calcium. The results of the study is that the urinary calcium excretion with calcium carbonate, so standard inorganic calcium carbonate, was not significantly different to placebo. So, but however, it was increased with Aquaman. So it seemed like subjects were absorbing more Aquaman than the standard calcium carbonate. And this was corroborated by a greater parathyroid hormone suppression. So the parathyroid hormone suppression seen for the inorganic calcium carbonate was somewhere between Aquaman and placebo. So it was being absorbed somewhat, but it only reached clinical significance compared to placebo at one time point. All right, so in the study, the bone mineral density in women above 40 following 3 bone health plans was compared. So this was using a product called AlgaeCol, which is similar to our Aquaman from seaweed. So previous studies of calcium and vitamin D supplementation were a little bit disappointing because they showed decreased bone mineral density loss. So there was less loss, but not actually an increase in bone mineral density. So in the study, they used women above 40 years with an above average compliance to supplements or medication and they compared their age-related expected bone mineral density loss when they followed 3 different plans. So basically, plan 1 was calcium, vitamin D, vitamin K2, strontium, along with exercise and education. Plan 2 was calcium, vitamin D, magnesium, K2, boron, vitamin C, and strontium. And plan 3 was the algae coal, which is like our aquaman calcium, plus vitamin D3 and exercise. And they found that in all 3 groups, there was an increase in bone mineral density by at least 1.3% after 1 year, and that the increase was proportional to compliance with their regimen. So just a little word about strontium. So occasionally you'll see strontium included in kind of clinical doses in some bone health supplements. So we have strontium present as a trace mineral in our aquaman, but we didn't add it in a large dose. So it is heavier than calcium. So studies have shown that it does increase bone mineral density, but that might not translate to improved bone strength and reduced fracture risk. There are also some concerns that it might displace calcium in bone if taken in the long term in high doses. And it does also have some serious side effects. So for this reason, we decided to include it as a trace mineral, but not to add it in large doses. Then aquaman has also shown a lot of promise in joint health, especially osteoarthritis. So as you know, osteoarthritis is a common progressive joint disorder affecting mostly older adults, characterized by joint degeneration resulting in pain, disability, and reduced quality of life. The most commonly affected joints are those in the hands, neck, lower back, knees, and hip. So in osteoarthritis, there's a progressive breakdown of cartilage, narrowing of joint space with associated pain, and consequently a reduction in mobility and range of motion. It accounts for 50% of the entire musculoskeletal disease burden, and thus it's considered the highest burden condition within this group of diseases, more so than rheumatoid arthritis and osteoporosis. So the onset of osteoarthritis is not only limited to aging, but it can also develop after injury or due to genetic factors. And additional risk factors include being overweight and engaging in activities that place undue stress upon joints. So currently there's no effective disease-modifying treatment that's able to cure osteoarthritis. The existing symptomatic treatments can only relieve pain, and however, only 54% of osteoarthritis patients reported receiving inadequate pain relief from their painkillers. So non-steroidal anti-inflammatory drugs are frequently prescribed, and these also have side effects. Some people wish to not take as many of them or can't take them because of side effects. All right, so in the study, well, let me go to the background first. So positive roles have been suggested for trace minerals such as boron, manganese, copper, selenium, and zinc in reducing the symptoms and slowing the pathogenesis of osteoarthritis. So there were initial anecdotal reports of the anti-inflammatory effects of aquaman. So studies were done to look at this. So 2 studies were done looking at patients suffering from knee arthritis. So in the first of these trials, subjects with moderate to severe knee osteoarthritis were assigned to one of 4 double-blind 12-week treatment groups. glucosamine on its own, glucosamine sulfate plus aquaman or placebo. Participants were asked to not take any painkillers except for paracetamol, and they were assessed for pain and mobility using a pain score and the 6-minute walk test. So if we look at figure 1 at the top there, the higher score represents less pain and stiffness. So the aquaman group showed significant improvements in pain, stiffness, and mobility, whereas glucosamine showed a significant, albeit less, improvement in pain, but not much improvement in stiffness. And then in the 6-minute walking test, the aquaman group walked an extra 7% compared to the glucosamine group, which the patients walked an extra 3.5%. So one result that's a little bit confusing, which you might have spotted, is that the group that received glucosamine plus aquaman seemed to do really poorly. So the authors speculated why that might be. So they had combined aquaman and glucosamine together in the tablet form, but they thought that it was unlikely to have reacted in the tablet form. So they speculated that it might be to do with the very basic nature of aquaman with a pH of 10 compared to the acidity of glucosamine sulfate with a pH of about 4, and the requirement for this to ionize in the stomach to be effective. So I don't know what the clinical implications of this are, but perhaps if someone is taking glucosamine sulfate and aquaman at the same time, perhaps to take them at different times so that they don't influence each other, or and then, you know, if they're providing relief, maybe try taking them at the same time and see whether the relief continues. Then in the second trial, aquaman was looked at to see whether osteoarthritis patients might be able to use less non-steroidal anti-inflammatory drugs if they were using aquaman. So patients with moderate to severe knee osteoarthritis were randomly assigned to one of 2 12-week treatment groups, aquaman or placebo, and they were assessed while they underwent gradual reductions in non-steroidal anti-inflammatory drug use. So at 2 weeks, they were asked to reduce their drug use by 50%, and at 4 weeks, stop altogether. And they were allowed to use paracetamol when necessary. So the results were, when non-steroidal drug use was reduced by 50%, so half, the patients in the aquaman group had improved pain scores, passive range of joint motion, and 6-minute walk test distances compared to the placebo group. So unfortunately, the effect didn't continue when the non-steroidals were discontinued completely, suggesting that aquaman may not be able to completely replace non-steroidals. However, they may allow for a reduced need for non-steroidals. All right, I think our time is running out. This was just a lab study looking at anti-inflammatory mechanisms. I'm just going to skip over this one for now. All right, so this was a study. We're now moving on to the gastrointestinal studies. The purpose of the study was to determine whether aquaman could be used as a dietary supplement for chemo prevention against colon polyp formation. So colon polyp formation is often the first stage in colon cancer. This was an animal study, and mice were divided into 3 groups based on diet. So the first group received a low-fat rodent diet. The second group received a high-fat Western-style diet. And the third group was fed the same high-fat Western diet with aquaman. And they were maintained on these diets for 15 months. So the results were that colon polyps were present in 20% of the animals on the high-fat Western diet and in none of the animals on the other 2 groups. In addition to grossly visible polyps, areas of hyperplasia in the colonic mucosa and inflammatory foci throughout the gastrointestinal tract were observed histologically in animals on the high-fat diet. but both of these were significantly reduced in animals on the low-fat diet and animals on the high-fat Western diet together with Aquaman. Then there was a second similar study where mice were maintained for up to 18 months either on a high-fat Western diet or a low-fat diet with or without Aquaman. So you can see that Aquaman reduced the incidence of polyps quite a lot. So in the standard diet from 23% to 11%, and in the high-fat Western diet from 31% to 3%. So taken together, these two studies' findings demonstrate that Aquaman protected mice on a high-fat diet against polyp formation in the colon. And also, the data suggests that increased calcium alone was insufficient to explain the lower incidence of colon polyps, as the mice without Aquaman's diet was substituted with as much calcium as was present in the Aquaman. So possibly a combination of the organic calcium and magnesium together with the trace minerals. This is a lab study looking at the calcium sensing receptor in human colon cancer cells. So the calcium sensing receptor is a robust promoter of differentiation in colon epithelial cells, and it functions as a tumor suppressor. So cancer cells that do not express this calcium sensing receptor are highly malignant, whereas those that do have it, it circumvents the malignant phenotype. So researchers hypothesized that chemopreventive agents mediate their action in preventing colon cancer through the induction of the calcium sensing receptor. And they compared calcium, vitamin D, and Aquaman to look at the induction of the calcium sensing receptor in human colon cancer cell lines. So all three of these, calcium, vitamin D, and Aquaman, induce the calcium sensing mRNA and protein expression and inhibited cell proliferation. But Aquaman was found to be the most potent of these three. And the induction of the calcium sensing receptor resulted in downregulation of tumor inducers and upregulation of tumor suppressors. So the study provided a rationale for the use of Aquaman in further studies looking into the chemoprevention of colon cancer. Then looking at liver tumors. So this was also an animal study. Excuse me. All right, so we know that overnutrition in the form of a high-fat or a high-calorie diet is associated with fat infiltration in the liver, otherwise known as non-alcoholic fatty liver disease. And some individuals with fatty liver disease develop inflammation culminating in cirrhosis. So in the study where animals were fed for 18 months on either high-fat or low-fat diets, numerous grossly observable liver masses were visible in the animals, particularly on the Western style high-fat diet. The majority of these were in the male mice, so 20 out of 100 males versus 3 out of 100 females. There were more liver masses in the animals on the high-fat diet than the low-fat diet, so 15 out of 50 on the high-fat versus 5 out of 50 on the low-fat. But Aquaman, taken together with these diets, reduced the number of liver masses in mice on both diets from 3 to 1 out of 25 in the low-fat diet, and from 12 to 3 out of 25 in the high-fat diet. And there were also much less hepatocellular carcinomas in the Aquaman group. So some of the tumors were benign or pre-malignant, but of the malignant hepatocellular carcinomas, there was only 1 in the Aquaman group and 7 in the unsupplemented diet groups, suggesting that Aquaman can protect mice against both benign and malignant liver tumors. All right, so our time is running out. Just to say that there was also, this is a study looking at Aquaman and Aquaman Magnesium on the gut microbiome. Just the results of the study in brief. So both of these increase the production of short-chain fatty acids and increase microbial diversity. And some of the really beneficial microbial lines were increased. And then I think we've said most of these benefits of boron for bone and joint health during the webinar. What I found interesting, this was a review paper, and it pointed out that in areas of the world where boron intake is usually quite high, so 3 to 10 milligrams per day, the incidence of arthritis is 0 to 10%, so really low, whereas where boron intake is less, quite low, the arthritis incidence skyrockets to 20 to 70%, so that was really interesting. Also to note that the boron concentration is lower in the femur heads, bones, and synovial fluid in osteoarthritis patients compared to individuals without osteoarthritis. And the conclusion that in the absence of studies showing harm, in conjunction with a substantial number of studies showing benefit, supported the consideration of boron supplementation at 3 milligrams per day, especially for individuals with a diet lacking in fruit and vegetables, or who were at risk of, or who had osteopenia, osteoporosis, or osteoarthritis. All right, so that's where we're going to end for today. Thanks for listening. I hope that Nina's been able to respond to lots of your comments and questions, but if there are any left over that she hasn't, we'll try and get back to you after the webinar, or do get in touch. Thanks for listening.